Smart Health just got smarter. Philips has been on the leading edge of innovation since its inception in 1893. 1893. They haven't slowed down. How is Philips getting smarter about targeting personal health? You're about to find out. I want to introduce you to our moderator, Jane Sarasone-Khan, who made it just in time for this session following her book signing for Gary Shapiro's book club. And not to mention, she's one of the smartest people in the room. Thanks.
Oh, stop. Hi, everybody. Hi, friends. Lots of friends here. Hi, Roy.
Hi.
So, yeah, I was picked for Gary's book club for this book. And it's not just about me that the book was picked, but what's really important is 9 books were picked for Gary's book club this year. And this is about health, healthcare, digital health, and privacy, which tells you that at CES, health is a really big deal. So we are a big deal in health at CES, and you should realize that health is really everywhere at CES, so it's really exciting. Anyway, I'm delighted to be here with Roy. This copy is for him. I signed it for him. But to kick our conversation off, I want to read from page 106. This isn't Mr. Rogers. This is just me telling you about how important Philips is in this paradigm. And this is page 106, where I say within a few weeks of early 2015, 3 meetings convened around the same time: CES, HIMSS, and South by Southwest. And only one digital health company was at all 3. It was Philips. And you're thinking, South by Southwest, what the heck were they there for? I was there talking about sitting is the new smoking or something. But Philips was handing out smoothies from food trucks all over Austin, because that's when the company doubled, tripled, quadrupled down on health. And here we are 4 years later since then, and it's really exciting. So I'm delighted to talk with you. This is your copy.
Thank you.
Enjoy. Jill titled this chat, which is only 20 minutes long, so we're going to move quickly, how Smart Health just got smarter. So I want to start out and ask Roy, how do you, Roy, and Philips think about smart in health?
So for us, smart in health means that actually the use of data allows us to become even more personalized in applying the clinical knowledge and know-how that we have within the company. Mm-hmm. So if you take it to certain consumer health domains that we are active in, like oral health or sleep or modern childcare, I think the revolution that you see now and the interest in consumer health happening is that it's not only about quantification, that you get more data, but actually that you can qualify them into what does it mean for an individual. And that we do based on our 100 years of history in our clinical and healthcare side of the business, and we translate that back into consumer benefits. And that's where I think the current interest is gouged around what data can do for people and what it can do for an individual consumer.
And so when you spoke in Berlin at IFA last year, you talked about from the quantified self to the qualified self. So that's what you're talking about.
Yeah.
The qualified.
I think you see, and a lot you see also today at CES, that is, quantification is booming. So there are measurement trackers and devices all over the place. Yeah. And it's important to get those data. That is important. But it doesn't stop there. The real value add of data is in the relevant interpretation of data and feeding it back to an individual or to a relevant diagnosis. And that, I think, in consumer health is a big new trend that we are working on in terms of seeing how we can actually interpret those data and help to give consumers advice, coaching, content that is relevant for them in their personal health journeys.
That's great. So if you saw Philips' press release, there are sort of 3 pillars of better. It's smile better, care better, and sleep better. So I want to talk about sleep first, because I've been coming to CES. This will be my 9th year. And sleep in the beginning was maybe a bed 9 years ago. But sleep is lots of things. We just saw with Dream. And sleep is a fragrance, and sleep is other things. So let's talk about Philips and how are you going to help me and everybody sleep better?
Yeah, I think sleep is an excellent example of where data and consumer health is making an impact. So we have a huge franchise in professional sleep care. So we treat a lot of patients, and from that we have collected data that we then put into algorithms that help actually provide real-time benefits. And give you an example of our headband. So in the headband, actually, we are measuring the slow waves of the brain during your sleep. And what clinical research has shown is that actually the longer you stay in your slow waves, the more energy you get out of your night of sleep, the more recovery you get out of your sleep. And then through the application of soft tones, we actually help you to stay longer in your slow tones. And that actually then really improves your sleep and your night of sleep. That's one of the applications. Another application that we have is to help you with snoring. So snoring is a consumer item that might sound maybe trivial to some, but actually 40% of men are snorers. And if you are lying next to them, you might know what it causes to you. So, of course, there
tell me about it.
Traditional methods where you can just pour and kind of move. So in our sleep snore relief band, we have a positional device that actually looks how you sleep and then gives you a small nudge to get you out of your back. Because one of the areas where you get into snoring is if you sleep in the wrong position. So we have a positional adjustment, and then actually it helps you to snore less. We also put it in a solution suite where actually we say the first step into a sleep journey should be analysis. So what is really your problem? Because we are also very careful in saying not all consumer health solutions will treat the sleep problems that a consumer might have. If you have a serious sleep disease, you need to see a doctor. You need to get a serious sleep device. We can also help you with that, but there's a different route to get there. With Smart Sleep Analyzer, we can help you to do that diagnosis. And again, Smart Sleep Analyzer, we have developed out of clinical research, where together with physicians, together with researchers, we came up with a survey that actually helps you determine which problem you have, so that actually we can give you the right recommendation for a solution. And from that, then you can determine whether you want to go into a sleep lab, whether you want to get into a headband, or you want to get into a snoring relief band. So there are next steps from there, but it starts with the right analysis.
And it seems that Philips has this goal of adding to portfolio, adding to solution, and providing really that overall experience and almost like a platform of solutions for a person, not just a one-off, which is really helpful. Those of us who are looking for consumer experience from healthcare and don't get it. So I find that a unique part of the way you guys deliver on these verticals. You know,
I think we consider two parts really important. One is that if you provide a solution in a certain domain, be comprehensive. So if you talk about oral care, of course we see a lot of toothbrushes out here. But if you want to treat oral care, you need to go beyond. You need also to floss. You need to see a dentist at times. So how can we make that total journey a seamless one? So yes, we have the best toothbrushes. And we were the first in making them smart and collecting the data. And then also coaching on the back of that. But now we're also connecting to, for example, what we announced here with Delta Dental, a collaboration where we connect to the payer. Because they have a direct interest in seeing a better treatment of the teeth. We're also doing research into systemic health that is connected to oral health. Because the mouth is a gateway to a lot of systemic issues.
Totally.
So we're also seeing other insurers coming to us, say, how can you help us to change behavior, routines, prevention in a way that actually it helps us to provide a better care, even for cardiac patients. We just saw the amount of cardiac patients. Also, we know from research and from big data analysis that if you have a better oral treatment and prevention regime, you actually will have a better cardiac profile as well. So those are links that we're making with payers. We're also doing it with providers. So when we introduced teledentistry last year as a service, it's again about making that connection into the ecosystem and using data to make that flow for consumer easier and more convenient, but also more effective to increase the access to care, to lower the cost, and to make it a seamless experience.
How does that teledentistry, how has that fanned out over the last year? Because I know it was announced last year. So how has that advanced in the year?
Yeah, so we have seen very nice uptake in the United States. We now also took it to Europe. So we are now building up the network as well as then adding the service into it. If you talk about Delta Dental, we will also add it into that partnership. So that actually you give a suite of solutions, but always at consumer will. We are also very clear that actually whatever we do in consumer health space, it should be at consumer consent. Whether it's data we collect, whether it's services we provide, they need to opt in and saying, okay, how far do we want you to go? The great thing about the personalized data is that we can get very personalized if you want us to. But in the Delta Dental, for example, we will not share individual data to Delta Dental without the consent of an individual. What we do share is anonymized data because they give us insights in better prevention, in better care programs that we can develop together.
That's great. And also in the U.S., where we have HIPAA, and employers need to stay away from that data that Delta Dental would have on employees. So Indeed. It's fascinating. I find this approach to adding services around the product really interesting. There are probably people from pharmaceutical companies in the room, and for years we've chatted in your rooms about value around the pill. So in this case, I wrote in my blog this morning about the Internet of Teeth, about your product, about P&G oral, I forget, I'm blanking out. It's been a long day already with the signing. And Colgate's product, not to mention competitors, but those are sort of the big three this year. But in this case, you're adding services around the toothbrush. And in the case of the Delta Dental relationship, I wanted you to explain that it's not just people sharing their data for free with no value exchange, but there is sort of a behavioral economic argument, which me as a health economist loves. Tell everybody about the exchange of value. When people share their data in the Delta Dental program, what do they get?
Yeah, so there's a mutual benefit. First of all, for the consumer, the benefit is that based upon better brushing and the coaching that we provide based upon the data that we collect, actually we know that actually their brushing behavior will get better over time. They will have the immediate benefit of less caveat, better oral regime. But also we want to stimulate this with a reward system, which means that if you brush according to the regime, you will get free brush heads. You will get support on acquiring any products and services and doing it at a discounted rate. So over time you will see that actually there is a positive reward that is in behavioral change. Because we know the hardest thing there is in consumer change is behavioral change. Absolutely. We also know that it's not about price alone. It's not that a price tag will actually bring people to change every day to 2 minutes of brushing. You need actually to give the personal incentive. So what is in it for you? And that's where I think the data again make the big difference. Because if I can show it's your mouth, these are your teeth, this is your problem, you might get more interested than saying, okay, in general, 2 minutes is really good for you. If you know that actually prevents your next month treatment, or actually if you have a gum problem, it can help you alleviate the pain of it, I think there is an interest to get into that next step.
And to Randy's point about going for zero, which is a program I also love, in researching my piece for today, I found out that mild periodontal disease raises your risk of stroke 2 times. So if you've got bleeding gums, get brushing and prevent stroke. And I thought that was an amazing statistic. So you're helping definitely connect the dots to heart disease and stroke as well.
And that's, I think, and again, that's where also our clinical and research arm really is doing a lot of work on to see how we can make that step to systemic health. Of course, we're also very active in the hospital. We also see that there's a huge need and desire from the hospital and the healthcare system to bring care into the home. And to make that bridge and actually start change consumer behavior, that's actually where we can be a bridging function. Because we act on both sides. We can bring the knowledge from the clinical side into the consumer, but we can also bring our consumer insights in terms of what it takes to change their behavior into the clinical side, and then actually tie the dots.
I was going to ask you about this. So Roy has a really good LinkedIn page. I'm not sucking up to him. This is just the reality. He really writes well on his LinkedIn. And you recently wrote about this on your LinkedIn, how you help bridge data between the consumer health side and the professional side. And as somebody who's worked in companies that have both a clinical side and a consumer side and others, there are silos in these companies. And when I'm trying to ideate something really cool and exciting to make that bridge, it doesn't happen. The corporate culture gets in the way, the lawyers get in the way. How do you guys make that work at Philips?
I think it's a very fair observation. And actually the observation also held true for Philips. We were a very solid company as well. I think when we changed our mission into a health tech company, that was in 2015, we became very apparent to the fact that actually there is really a need to bring these worlds together. And actually what is really the driving force is the consumer and customer side. When customer starts to tell you they want you to bring it together, there should not be any internal argument not to go there. Actually, you should run after what the customer asks you to do or what the consumer tells you to do. Yeah. And I think that was for us also really the strengthening force of even within Philips, starting to go beyond these boundaries and starting to connect the dots. And these are very different worlds, because if you are developing MRIs, if you are developing CTs, or if you are developing a toothbrush, yes, that is a different kind of area that you're working in and coming from. But actually now we are learning that there's a lot of collaboration in between. We're bringing expertise, for example, from regulatory requirements into the consumer space, which is very important if you want to do proper consumer health. Sure. It needs to be regulated, it needs to be approved, it needs to be quality standard at the highest norms. As well as that, we bring the consumer behavioral change learnings into the professional side. Right. That actually have a very different take on how you change behavior, because if you go into the hospital, there's not a lot of free will. Actually, you will be guided by the system, where consumer determines where they want to go. Now, those are very interesting areas that we are working to bring together.
There's one other secret in the sauce that Philips has, I think, and it's the design function. So it was brought up in Randy's presentation, these great design awards that Amron has won laudably. But you guys are like design gurus all over the world. Can you talk about how you do design both on the professional side and the consumer side? Because I think a lot of people don't understand, even when we think about how an ICU functions, it has to be designful. Yes. And yet we don't often think about workflow design. So can you talk a little bit? Because it's a unique Philips kind of ethos.
Yeah, and I think it's also something that, again, from a customer perspective, we see a huge demand for. Because what we are working on and what we are doing together as an industry and an ecosystem is redesigning the consumer journey, the patient journey, and the workflow of the system that goes with it. Now, that's exactly what design also does. So design, of course, has a huge role to play in feature benefits, in functional design, but also in workflow design. Actually in co-creating that journey. So often what we also do with design is actually bringing customers, hospitals, bringing consumers, bringing payers and employers together, and actually have co-creation sessions where we then design new journeys.
That's great.
Now, that's where actually you see that it takes opening up, bringing perspectives from all different players to the table, and then finding new ways together. And I think that's also what in our open innovation approach is very much kind of stimulated, that actually we don't consider ourselves as domain owners that actually need to do every step along the way. We want to be orchestrators where we have clinical know-how to be able to claim and do that. But then we need to bring the relevant people and pieces together. And I think that is a very exciting journey that we are still at the early stage on. Because to be honest, I think consumer health is just taking off in the new way that we can really get the full benefits out of it.
So with just a couple minutes left, can you give us a hint about what we might see toward CES 2021, or at least on the journey this year?
No, I think what you will see more of is that we are connecting the consumer and the professional world. That's a journey that we are very strongly embarking on, that we see a very strong use case for the benefit of the consumer and the system. And that's actually still early stage. We're taking step by step. So if you would indeed go 4 years back in oral care, we would come out with the first connected toothbrush. The year after we came with a personalized coaching program. The year after we came with teledentistry. The year after we come with Delta Dental. Next year you see us widening it to the next set of stakeholders in that system.
That's great. And all helping get smarter in healthcare.
Indeed.
I heard Steve Koenig, who's the VP of Research for CTA, did his 2020 Consumer Tech Forecast on Sunday, and he talked about the last 10 years was about the IoT of the Internet of Things, but this next 10 years is about the intelligence of things, a different wrinkle on IoT. And I think you guys are really well positioned to move from that IoT version 1 within this data-rich world, connecting everything together, mashing it up to the intelligence of things for helping healthcare get smarter. So thank you, and thank you all for being with us.
Thank you all.